Well, hello there. I had some technical difficulties. Not sure if you guys are able to jump on, but I'm going to go ahead and make sure that we're all good to go now. Okay, fantastic. I apologize for that. Okay, wonderful. So we're back on. I apologize for that. I was just in the process of introducing myself. My name is Dr. Yvette Flores. I am a physical therapist and senior clinic manager for Lake Sumter, Spanish Springs, and Grand Traverse locations here at the Villages, Florida. And I am so excited to be hosting today's Facebook Live session. We will be discussing all the confusions and the wondering about, well, what do I choose when I have pain? Do I choose a hot pack or do I choose a cold pack? So I'm super excited to be disseminating some information today, and the goal of the session is to be able to instill confidence and knowledge in you so that the next time you have pain, you're going to be able to know with confidence what you're going to be picking, if it's going to be a cold pack or a hot pack. So I wanted to jump right in there and throw out a couple of scenarios just to see how many of you feel like you already know the difference between when to choose a hot pack versus when to choose a cold pack. And if you get them all right, then awesome. If not, it's okay. Hopefully then you'll know after today's Facebook Live. So again, if you just joined us, my name is Dr. Yvette Flores, and I am a senior clinic manager here for 3 clinics in the Villages, Lake Sumter, Grand Traverse, and Spanish Springs. Okay, so here's my pop quiz. First question, let's see how much you know about when to use and why. Number 1, a 16-year-old basketball player complains of left ankle pain during a game of basketball yesterday. He has pain with walking and is noticing that it has gotten worse and a little swollen. What should he use? Should he use a cold pack or a hot pack? So the answer to that particular scenario would be a cold pack. And the reason being is because he just sustained an acute injury, meaning a new injury just the day before, playing an active game. So he developed the pain doing something active just a day prior. In addition to that, he's not only having pain today, but now he's noticing that his ankle's gotten a little swollen. So in that scenario, we want to reach for a cold pack, because a cold pack has been successfully proven to reduce inflammation, to calm down pain, to control swelling. And so it's utilized a lot in acute cases, acute injury cases. So if you got that one right, awesome job. All right, let me give you a second scenario. Here's the second one. Number 2, a 60-year-old lady complains of neck and shoulder pain when she got up from bed one morning. She is having a hard time turning her head and she feels a lot of stiffness. She didn't do any unusual activities the day before. What should she choose? A hot pack or a cold pack? I'll give you a second to think about that. Again, she had neck and shoulder pain getting up out of bed one morning and now has a difficult time turning her head and reporting feeling lots of stiffness. And she didn't do any unusual activities the day before. So the answer in that scenario, if you guessed it correctly, is a hot pack. This particular individual is complaining of a lot of tightness in the area, the muscles. So muscle tightness could be described as stiffness, could be described as pain or difficulty with motion. There is no particular mechanism of injury. She did not engage in any activity or anything unusual the day before. So in my clinical opinion, I would look at this and say she probably developed a stiff neck from awkward posturing when she was sleeping the night before. So in this particular case, I would educate her to try to use a hot pack and see if that helps to reduce some of that stiffness and improve her comfort levels. All right, so I'm hoping that of those two so far, you guys are guessing the right answers. I got one more scenario for you to think about. All right, here we go. A 70-year-old man complains of right knee pain and swelling after going through a complete total knee replacement surgery a couple of weeks ago. Let me repeat that. A 70-year-old man complains of right knee pain and swelling after going through a total knee replacement surgery 2 weeks ago. What should he use? All right, so if you haven't guessed, and I'm assuming if there's some physical therapist on the call and they are treating patients from specific doctors here in Central Florida, this was a trick question. Typically, and in majority of cases, surgeons will educate their patients to use ice right after surgery. Ice because, again, of the properties of successfully helping to reduce and maintain inflammation. And inflammation is a big thing post-op, right? However, this is where it's tricky. There are some surgeons, particularly in our area specific to total knee replacement specialties, that educate their patients not to use ice. In fact, they educate their patients to use heat. Not heat directly on the incision, but heat above and below, like heat, for example, on the quad muscle or, the top of the thigh, or heat below on the calf muscle or the back of the lower leg. Why is that? Okay, so we already know and we discussed the benefits of using a cold pack after surgery, but why would a surgeon say don't use ice, use heat? Well, in a particular case that I'm thinking about, the focus is not necessarily on reducing swelling near the incision per se by applying something directly on that area. The focus is on improving circulation above and below in the large muscle groups, the quadriceps and the calf. The reason being, with open vasculature and better blood flow, some of the swelling that's happening in the middle, right where the knee was replaced, will be dispersed, and through that method, healing will take place. So that's one reason, which I think is pretty amazing, right? However, here's what I'm going to tell you. Don't think that because a particular doctor is educating patients to do it that way, that is the best way for all, because that's not necessarily true either. I would definitely add a disclaimer right now that if you or someone you know is about to undergo any kind of surgery, you want to follow the doctor's protocol. You want to follow if the doctor is saying to use ice or to use heat and when. So that's what I would say. But those were my three, and hopefully you guys were able to get those answers correctly. But I wanted to dive deeper now into exactly what are the differences between using heat therapy versus cold therapy. So we're going to jump right in, and first I think I want to start talking about heat. So when I think about using hot packs, the first thing I think of is when you apply something hot on a body group like a muscle, the first thing that I know happens is that there's improved circulation and there's improved blood flow to that particular area due to the increase in temperature that happens due to the hot pack. Increasing the temperature of the afflicted area even slightly can soothe discomfort and increase muscle flexibility. So heat therapy is great at helping to relax and soothe muscles, and thereby helping to help heal damaged tissue in that area. So examples of individuals or particular cases where heat is fantastic, I would say, when muscles have developed a lot of stiffness and tightness due to repetitive activity. I would say when muscles have developed a lot of tightness and stiffness due to poor posturing or stress. I feel like a hot pack would be the best method or the best choice for reducing discomfort because of that. Now, in terms of heat, There are two different types of heat therapy. There's dry heat and there's moist heat. Both of them should aim to just warm the area of the body, and that would be considered the ideal temperature, is something that you could say is warm instead of hot. We don't want to be there. I'm going to be going over some potential risk factors if we are not utilizing heat therapy correctly in just a second. The two main kinds of heat therapy is dry and moist. Dry heat, which is also known as conducted heat therapy, includes sources like heating pads, dry heating packs, or even saunas. These are very easy to apply. Moist heat, or we call that convection heat, includes sources like steamed towels, moist heating packs, or hot baths. There's a lot of literature that says that moist heat may be slightly more effective, as well as require less application time for the benefits of what's gained when we're using heat. It's kind of interesting because I've done some research and I see that there are some brands now that are creating electrical hot packs that are designed to emit moist heat. And so those would be like the best ones, I feel, that could be great to choose. Okay, so let's talk about when not to use heat. There are certain cases where heat therapy should not be used. If the area in question is either bruised or swollen or both, it may be better to use cold therapy. Heat therapy should also not be applied to an area with an open wound. Also, people with certain pre-existing conditions should not use heat therapy due to a higher risk of burns or complications. These could include diabetes, dermatitis, vascular diseases, deep vein thrombosis, or muscular sclerosis. If you have either heart disease or hypertension, you definitely want to ask your doctor before using heat therapy. If you are pregnant, you definitely want to check with your doctor before using saunas or hot tubs. All right, so I'm going to show you the heating pad that we have here. It looks like this. This one is the extra large one, and it comes with a dial so that you could select the temperature that you would like. And this one is pluggable, okay? So we love this one because it is moldable, it's flexible, you could wrap it around joints, you could lay on it, you could strap it on around the shoulders and the neck because it has this Velcro system here. This is the one that we would recommend for patients to purchase. And we actually have a website where you can purchase this. And I believe there's a promotion going on right now for buying both a hot pack and a cold pack together for the month of August. You actually get an extra discount if you purchase it for the month of August. And we can talk about it a little bit more, but the website is called coraphysicaltherapy.therapyessentials.com. So you definitely want to check that out. Okay, so we talked about heat therapy. Let's definitely jump right into cold therapy. I just wanted to make sure we have some time there. We do. Okay, so cold therapy is also known as cryotherapy. It works by reducing blood flow to a particular area, which can significantly reduce inflammation and swelling that causes pain, especially around a joint or a tendon. It can temporarily reduce nerve activity, which can also relieve pain. There are different types of cold therapy. You can use ice packs or frozen gel packs. You can use coolant sprays, ice massages, or ice baths. In some cases, there's areas where they offer even whole body cold therapy chambers and cryokinetics and cryostretching. But in terms of what's available for us, things that are easy to obtain for home use, I would recommend a simple, extra large rectangular cold pack. And I will show you what that looks like in a second. I wanted to talk about when not to use a cold pack. People with sensory disorders that prevent them from feeling certain sensations should definitely not use cold therapy at home, because they may not be able to feel if damage is being done. This includes diabetes, which can result in nerve damage and lessened sensitivity. You should definitely not use cold therapy on stiff muscles or joints, and you should definitely not use cold therapy if you have poor circulation. All right, so what are some potential risks? How do you apply the cold therapy? Now would be a good time for me to show you the cold pack. Now there's different kinds of cold packs, but you definitely want one that's moldable. And the ones that we have available to you on Therapy Essentials website is definitely moldable. So you could wrap it around joints very nicely. You could put it around your neck and your shoulders, your knee, your ankle, anywhere you would need it. You can lie on it so that you could get some cold therapy to your back. But I always recommend the one that looks really large, right? The one that looks really big, because that allows you to cover a larger area, and there's more options with covering joints fully. And so that definitely is also available on our Therapy Essentials website for purchase. Okay, so let's take a look here and let's talk about overall takeaway. Knowing when to use cold packs, knowing when to use hot packs. Both have been proven to have value. Both have been proven in studies to be effective means. They are cost effective, they're easy to access, and easy to use at home. So if we were to go back to the original 3 questions that I had asked in the beginning, I'm sure we're all going to get these right on the money. So the first one that I had asked was about the 16-year-old basketball player complaining of left ankle pain during a game the day prior. I asked what would he choose, hot or cold? We all now know that a cold pack would be the best choice for his left ankle pain. The second one was the 60-year-old lady complaining of neck and shoulder pain when she got out of bed one morning, complaining of stiffness and having a hard time turning her head. We decided that the best choice for her would be a hot pack, because it would help to reduce some of that stiffness in her muscles and allow for more circulation so that she can then more comfortably move her head and her neck and feel less of that stiffness. And then the last one, which was the trick question, was the 70-year-old man who had the total knee replacement done a couple weeks ago. What would he choose? And we decided the best thing to do is to follow the instructions of the surgeon, because some will say a cold pack, where some may say don't use a cold pack but use a hot pack. But we already went through the reasons why and the benefits, and hopefully that was some helpful tips, some simple helpful tips to allow you to make a really good informed decision on what to select for your particular needs and for what's causing your pain. All right. For more information on any of this, you can definitely email me. I'd be happy to be a source of information for you. My email is yflores@corahealth.com. Some of the things that I researched and some of the information I gathered for today, I found through Healthline. There was a section there where they were discussing some recent information on treating pain with heat and cold. So you can also check out Healthline as well. So that concludes my time with you. Thank you so much for having me, and you guys have a wonderful rest of your day. Bye.